We made a research on breast cancer mortality trends over the world. We chose to study breast cancer because it's the primary site of cancer in women and represents worldwide a quarter of all cancer in women. And breast cancer is still increasing, so it's an important health problem. So we chose to study the mortality, the breast cancer mortality, because mortality is the best marker of the burden of a cancer, because it integrates all components of cancer control. It includes the risk factor, treatment, and cancer management. And also, it is important to compare the trend between countries, because it helps to identify which healthcare system is the best efficient at reducing breast cancer mortality. So we extracted data on breast cancer deaths and population from the Health Organization, the World Health Organization database, and we computed an age-standardized mortality rates for all women and for women aged below 50 years, between 50 and 69 years, and above 70 years, on the period 1987-2013. And also we assess changes in mortality trends through the computation of the overall percentage change on the period 1989-2013. We observe that breast cancer mortality declined in 39 out of 47 countries. However, breast cancer mortality is still on the rise in most Latin American countries and in Asian countries. So there are age disparities between countries around the world, with changes in mortality ranging from a 46% decrease in England and Wales to an 83% increase in breast cancer mortality in South Korea. One would say that the mortality declines depend on the mortality rate in 87-89. That is true for some countries such as England and Wales, where the highest mortality rate was observed in 87-89, and where the highest decline was also observed. But in groups of comparable countries, that is, countries with the same economic status and the same geographical location, we observe sharp contrast in mortality change. For example, in Latvia and Slovakia, the same mortality rate were observed in 87-89, but we observed an increase in mortality in Latvia, while a decrease in mortality was observed in Slovakia. Another example is Australia and New Zealand, which had the same 40% decline in breast cancer mortality, but their mortality rate in 87-89 were different. We also observed that the largest decline in breast cancer mortality was observed in the young women, that is, women below 50 years old. This may reflect the low proportion of older women being treated. Young women tend to receive more intense treatment with several lines of chemotherapy than in older women. Also, oncologists are more reluctant to give intense treatment to older women because of their age and their weaker health. We observed an increased breast cancer mortality in most Latin American countries, and in Asian country with the highest increase in South Korea. In these countries, breast cancer incidence is rising for different reasons. In Latin America, there are several changes in demographic changes, but particularly the aging population and the socioeconomic development. In South Korea, major societal changes occurred since the 50s, with the country evolving from an agricultural and developing country to an industrialized and westernized country. Breast cancer diagnoses are made at an advanced stage, and there is a limited access to efficient treatment that are responsible for the increase in breast cancer mortality. The drop in breast cancer mortality seems to be mainly driven by the advances in cancer management, such as the early adoption of new and efficient treatments, the improvement in surgical procedure, the improvement of treatment effectiveness, and also the improvement in patient management with a large access to care. Regarding the role of screening on the decline of breast cancer mortality, based on this data, the role of screening at reducing breast cancer mortality is questionable, as in similar countries with the same mortality rate in 87-89, we observed the same decline despite the timing of introduction of mammography screening. For example, in Netherlands and Belgium, mammography screening were introduced in 1988 and 2005, respectively. And we observed the same decline in mortality rate. And also in young women, we observe same declines in countries where mammography screening is widespread since the late 80s, such as in Sweden, and in countries where mammography screening has been always uncommon, such as in Norway. Future research on breast cancer mortality should focus on other facets of breast cancer management, such as risk factors, access to care, and drug therapies, and use of multidisciplinary teams.